Hi, my name is LoriFloyd. I'm making this video as part of my NU607 Advanced Health Assessment class at Jacksonville State University, where I'm an MP student. This is my volunteer that's going to help me with my video. This video is a focused assessment on the neurological system. I've washed my hands, closed the door, and I've got gloves to put on if I need them. Hi, my name is Lori. Hey, what brings you into the clinic today?
I just moved here and I just wanted a healthcare provider.
Okay, well, while you're here today, I'm going to perform a neurological assessment. I'll ask you various tasks and then evaluate the results. Do you have any questions before we begin? Okay, throughout this assessment, we'll assess the cranial nerves, we'll assess cerebellar function, we'll assess sensory function, and we'll assess the superficial and deep tendon reflexes. So we'll start with the cranial nerves. Cranial nerve 1 is the olfactory nerve, it's a sensory nerve. I will provide the patient with different scents and ask the patient to identify the smells, and then this would indicate cranial nerve 1 is intact. Cranial nerve 2 can be evaluated different ways. We can use a Snell and eye chart to assess our visual acuity. We can use our ophthalmoscope to assess the fundus, the optic disc, and the retina. And the vasculature, and I'm going to assess it using the confrontation test. So I'm going to bring my hand into your view with different numbers. Just tell me how many fingers you see.
2,
Okay.
3,
Good.
4, 2.
Okay. Cranial nerve 2 is intact. Cranial nerves 3, 4, and 6 can be assessed together. Cranial nerve 3 is the oculomotor nerve. Cranial nerve 4 is the trochlear nerve. And cranial nerve 6 is the abducens nerves. These nerves can be assessed by assessing the eyelid for drooping, can also be assessed for assessing perla, consensual eye reaction, and also extraocular eye movements. So I'm going to assess the patient now with my pen light and assess for perla in the eyes and also assess for consensual light reaction. You look straight ahead for me. Okay, pupils are equal and reactive. Now I'm going to cover one eye and shine the light in the opposite eye and watch for pupil constriction in the covered eye. Okay, consensual light response is intact. And now I'm going to assess extraocular eye movements. Can you follow my pen light with only your eyes? Don't move your head. Okay, this shows cranial nerves 3, 4, and 6 are intact. All the muscles are innervated by cranial nerves 3, except the superior oblique muscle and the lateral rectus muscle. The superior oblique muscle is innervated by cranial nerve 4, and the lateral rectus muscle is innervated by cranial nerve 6. We're going to assess cranial nerve 5, which is the trigeminal nerve. Can you clench your teeth for me? Very good. Can you move your jaw from side to side? We can also assess the corneal reflex by taking a wisp of our cotton and touching it to the patient's eye, and we can also assess for sensation of touch with the patient's eyes closed. So with your eyes closed, can you tell me if you feel a sharp sensation or a soft sensation?
Soft. Sharp. Sharp. Soft.
Okay, very good. Cranial nerve 5 is intact. We've assessed cranial nerve 6 with our extraocular eye movements. Cranial nerve 7 is the facial nerve. We can assess this by offering the patient different kinds of tastes to the posterior 2/3 of the tongue, but we're going to assess it by facial movements. Can you smile? Can you frown? Can you puff out your cheeks? Can you wrinkle your forehead? Cranial nerve 7 is intact. Cranial nerve 8 is the acoustic nerve, and we assess this through sound and auditory stimulus. So we'll do the whisper test. I'll ask you to cover this ear and tell me what you hear.
4.
Okay, and I'll ask you to cover that ear and tell me what you hear.
Ball.
Now we're going to assess using our tuning fork. We do the Weber and Renee test. Weber test. I'm going to strike my tuning fork, place it on top of the patient's head. Can you tell me if you hear the sound equally in both ears?
I hear the same.
Okay. Weber test is normal, and we're going to do Renee test. I'm going to strike my tuning fork, place it on the mastoid bone behind the ear, and ask the patient when you stop hearing the sound. Okay?
Okay. I didn't. Stop.
Okay, these are normal findings. Air conduction was greater than bone conduction in 2-to-1 ratio. Cranial nerve 9 and 10 can be assessed together. Cranial nerve 9 and cranial nerve 10, the vagus nerve, can be assessed by assessing for gag reflex to see if the patient has a gag. Can also be assessed by assessing the patient to swallowing. Can you swallow for me? Very good. And it can also be assessed by watching for symmetrical rise of the palate and uvula when the patient opens their mouth. So can you open your mouth and stick out your tongue for me? Say it all. Very Very good. There was symmetrical rise of the uvula and also the palate. And cranial nerve 11 is the spinal accessory nerve. We're going to assess this by applying some resistance and let the patient apply some force back. So we're going to assess the trapezius muscle. Can you raise your shoulders against my hands? Very good. And then we're going to assess the sternocleidomastoid. So can you push your face against my hand? And also this way. Very good. Cranial nerve 11 is intact. And then cranial nerve 12, the hypoglossal nerve, we're going to assess it mostly just by assessing the tongue. Can you stick your tongue out and move it side to side? Can you stick your tongue up and press it into your cheek on both sides? Very good. So this concludes our cranial nerve assessment. Now we're going to move on to our cerebellar function assessment. First, I'm going to ask you to put your hands on your knees and move them up and backward and forth in a rapid motion. Very good. All right. Rapid alternating movements intact. Now I'm going to ask you to touch my finger with your finger and then go and touch your nose. Very good. And now we're going to assess for balance with the Romberg test. If you could stand up. With the Romberg test, I'm going to ask you to put your feet together, arms to the side. I'm going to assess for any kind of swaying or any kind of imbalance. Also going to ask you to spread your feet apart a little and to stand on one foot. Very good. And to stand on the other. And then if possible, can you stand on one foot and hop? Very good. And then the other foot. Very good. That was our Romberg assessment. Now I ask you to just, the length of the assessment table, just walk back and forth so I can assess your gait and do heel to toe. Very good. Steady gait, rhythms are symmetrical and smooth. Okay, I ask you to sit back down. Now we'll assess sensory function. So first we're going to assess for superficial touch and pain. So I'll ask you to close your eyes. Tell me if you feel when and if you feel anything.
Right there, soft. Right there, soft. Soft.
Very good. So that superficial touch is intact. Now we're going to assess for pain. I have a sharp object I'm going to press against your skin. Tell me when you feel the touch.
Right there. Right there. Right there. Right there.
Okay, very good. Now I'm going to assess different joints of the body with my tuning fork. And tell me if you feel the vibrations on your joints, okay?
Eyes closed. Open.
You can have your eyes open, that's fine.
Okay.
Okay, good, you're doing good. Alright, let's do one more. You feeling vibrations?
Yeah.
On your joints? Very good. Alright, now with your eyes closed, I'll ask you to stick your hands out in front of you. I'm going to move your fingers in either up or down. Please tell me which direction I'm moving your finger, okay?
Okay. Up. Down. Up. Up.
Very good. You can open your eyes back up. Now we're going to assess for object identification. So I've got two objects in my hands. If you could close your eyes, please tell me what I place into your hand, okay? You can feel it.
A coin.
Very good. And I'm going to place in your other hand. Tell me what you feel.
A paper clip.
Very good. And that was testing for stereognosis. Now we're going to do 2-point discrimination. Let you close your eyes again for me, okay? Tell me if you feel 2 points of touch or 1 point of touch, okay?
2.
Very good.
2. 2.
You want to do your back real quick?
2.
On the back of your arm.
2.
Okay. The patient felt 2 points of touch, even in a close proximity such as on her finger. And now if I let you stick your hands out in front of you, I'm going to draw a letter and a number on your hands. You can tell me what this is. This will test for graphesthesia. So close your eyes, please. I'm going to draw a number on your hand.
8.
Very good. And I'm going to draw a letter on your hand.
M.
Very good. Okay, so finally for sensory function, we're going to finish up by testing sensation to touch. So I'm going to let you close your eyes, and you tell me where you feel a touch at, okay?
thumb,
Very good.
my shoulder, my elbow on this side,
Very good.
my knee.
Okay, you can open your eyes back up. So the patient can identify touch where it's stimulated at. So finally, we're going to finish up with our superficial and deep tendon reflexes. Superficial reflex, we're going to test the abdomen. So I would have the patient lay flat. I'm not going to ask the patient to do it for this part, but ask the patient to lay flat, and I will stroke up and away from the umbilicus and down and away from the umbilicus, and watch for the slight movement of the umbilicus in the direction my hand is moving. Also going to assess the cremasteric reflex, which would only be assessed in males, but where you take your hand, you do slight strokes, proximal to distal down the inner thigh, and you watch for the testicles and the scrotum to rise on the side that you're stroking. And now we're going to do our deep tendon reflexes. So I'm going to got my reflex hammer. We're going to start with biceps. So I'm going to ask you to raise this arm up. We'll flex at about a 45-degree angle. I'll support the patient's arm with my hand, and I'll use my reflex hammer to strike against my thumb. Okay, positive or 2+ reflex there. Then I'll do brachioradialis, have the patient's arm slightly pronated, about 1 to 2 inches up from the wrist. I'll strike for the brachioradialis tendon. Very good. Now I'm going to do a test for the triceps. So I want the patient kind of hang up their arm right there, assess for the tricep tendon. Very good. Now I'll let you lay your arm back down. So now we're going to assess for the patellar tendon reflex. So once you hang your leg down for me, strike at the patellar side. Very good. Positive reflex there. And now I'm going to assess for the Achilles tendon reflex by holding the patient's foot and striking at the Achilles tendon. Very good. And finally, we're going to assess for ankle clonus. So I'm going to let you relax your leg. I'm going to move your ankle around a little bit here and get it relaxed. And I'm going to dorsiflex briskly the patient's ankle a couple times and watch for any kind of abnormal movements. So here we go. Okay, and that was negative for ankle clonus. So do you have any questions? This concludes my video.